What is a private healthcare advocate? Nursing has always taught that one of our main roles as a nurse is to advocate for our patients. So it's nothing new to the nursing field. It is something that's kind of growing and evolving, I think, though. There's plenty of advocacy agencies. There's governmental agencies, the CDC, the NIH, the U.S. Department of Health and Human Services. Those are all government health advocacy organizations. There's not for profit organizations. There's disease specific agencies such as the American Cancer Society, the American Heart Association, things like that. Those are advocacy groups. Um, there's private agencies as well, and they'll fight for kind of more specific issues or billing issues. Um, there's ones called PayPal or Health Advocate. Those are agencies that you could look into if you needed help with billing issues or specific issues like that. Um, but a private healthcare advocate is a field that seems to be growing because um, the healthcare system is difficult to manage, right? And it's helpful to have someone who's there to help you filter through the information that you're receiving and to know what to do with it. So, as a private healthcare advocate, my goal is to enable each patient to meet his or her unique healthcare needs and to live life to the fullest. So, what does that look like practically? Well, what that looks like is medical record organization. I know I've had plenty of patients who have just a really difficult time managing keeping their medicines and their medical histories in order. So, as an advocate, I would like to help people with that. To organize their medications. I've had patients thinking that, this anti seizure med was for their nausea and then taking that medication to help with nausea. And obviously, that doesn't work. So, to help organize medications and to educate, education is another huge issue that advocates can help provide. Yeah, chronic care management, so to help people understand their diagnoses and the day-to-day things that they can do to help manage that care, to improve their quality of care, care coordination, helping with transportation to and from doctor's appointments, to provide another set of ears at that doctor's appointment, because it can be a lot of information thrown at you at a doctor's appointment, and it's nice to have someone who's there who can help you understand what's being said. I've always felt like that was one of my main jobs as a nurse, is to make sure that patients understand what the doctor has just told them, and just to try to break that down for them if they need it to more. Um, yeah, other services would be like in-home regular nursing assessments. That would be vital signs. That would be listening to your heart, listening to your lungs, checking your skin, checking your feet, and making sure that all of those things were okay, and then reporting that information if need be to your physician. Having a nurse advocate can help. He or she can act as a liaison for you, to help communication between you and your physician, to just facilitate that care. I guess this is maybe a good place to have a segue that your advocate can't diagnose you, right? I should just say that legally. A nurse cannot diagnose you. Rather, an advocate is here to facilitate the communication and to streamline your care, your diagnosis, and your treatment. That's how nurses function in the hospital, right? They take your blood pressure, they do your assessment. If they see something's off, then they report that information to your doctor so that your doctor is able to order the correct medications or whatever it is that's needed, or testing. So the advocate would work for that, to that end, within the home setting as well. Um, What else? Oh, just communication between family members, organization of medical history will help make sure that everyone's on the same page and that everyone understands what's going on, really. Working as a private healthcare advocate, I also see being able to just spend time with people. Companionship helps mental health so much. And unfortunately, sometimes when we're at home, lives are busy and it's hard to spend that time one on one with people. So, companionship helps with mental health and mental well being very much. And working privately as well, I believe very strongly in praying for my patients. And so, spending that time, whether together in prayer or just alone in prayer. And then I think also really trying to facilitate an attitude of gratitude and what we can be thankful for. Those are kind of, on the spiritual and the mental side of advocating for patients, but I think that it's very important and something that I take seriously in taking care of people. So, another service that a private advocate can provide is care after a minor procedure. I've had many patients over the years who it's hard just to find a ride to get to a procedure, and after receiving any kind of anesthetic, it's not like you can just call an Uber to go home. The hospitals typically won't let you do that. You need someone who's trusted and who can take care of you and responsibility for you. So working as a private advocate, we'd be able to provide that for you as well. I think that's all that I have to say about private healthcare advocates, except that needs change. And so as those needs come up, we can address them as needed. Thanks.